reflecting on this pandemic years from now, doctors think we'll be impressed by the speed of science, but depressed by society's response.
This is In the Loop. I'm Christian Bryant. At times, this pandemic has felt more like a pandemonium. You know what I'm saying? One of the main things I've learned is that I've never been more confused. But tonight we're going to clear some things up, not just for my own sanity, but hopefully yours too. Because, man, I could honestly fill this whole hour-long show with misconceptions around these dang shots. One fear that's been going around has been that these vaccines can cause infertility. The Kaiser Family Foundation reports that 42% of young adults had heard that claim. More than half were unsure if it was true. But we are here to tell you there's no proof that points to vaccines causing infertility or miscarriages. Doctors at the University of California, Irvine's Family Health Center say during clinical vaccine trials, several people actually became pregnant. And for what it's worth, more than 100,000 pregnant people have been vaccinated against COVID. Another unsupported claim floating around: 6,000 people died from the COVID-19 vaccines. After Representative Marjorie Taylor Greene tweeted that, it got her temporarily suspended from Twitter. The CDC says this is false. People are misinterpreting data from the Vaccine Adverse Event Reporting System. Basically, the system compiles data of people who died and happened to get the vaccine during their life, but it does not mean they died because of the vaccine. What's that saying? Correlation does not imply causation. Now, to be clear, there have been rare deaths linked to the vaccine after some people developed rare blood clots. Yale Medicine says they diagnose only about a couple of patients a year with these rare types of clots, and they're usually caused by dehydration, inherited disorders, or infections. On to the world's most controversial piece of cloth: masks. We got a lot of guidance on these things since the onset of the pandemic, and it's felt like it's constantly changing. At first it was, we don't need to wear masks. Then they became mandatory. Now, almost a year and a half later, it's vaccinated people don't need to wear masks, but also sometimes we do. So, I'm here keeping one in my pocket, but what is really the best move? For starters, it's important to point out they do decrease your chances of catching COVID. The Journal of American Medical Association says they not only block exhalation of droplets from someone who might have COVID, but they also provide a barrier for people who are COVID-free. Their studies showed multi-layer cloth masks were more effective than single-layer. And if you're more of a visual learner, take this experiment from the New England Journal of Medicine.
Stay healthy. Stay healthy. Louder. Stay healthy. Nothing.
It's worth noting, no one ever said wearing a mask is a foolproof barrier against COVID, but it can cut down your risk. The more complicated question to answer is, will they be required? Since the Delta variant has become the dominant variant in the US and has continued to spread among unvaccinated people, some health experts, like the former US Surgeon General, say the move away from masks for vaccinated people might have been premature. And the CDC now seems to agree. According to their newly updated guidance this week, fully vaccinated people should go back to wearing masks in public, indoor areas, and that includes schools. It might feel like a 180 on their previous advice, but we talked to one doctor who explains why the newest data warranted the switch.
From several outbreak investigations where they were looking at transmission, they were able to see that the amount of virus in the nose of people who were fully vaccinated and had gotten sick was the same as in people who were unvaccinated.
So if there's a too long didn't listen takeaway here, while mandates may fluctuate, the layer of protection we know masks can provide does not change. I have a personal list of lessons learned during the pandemic, like wash a mask often because it smells, but there's an even longer list generated by the hundreds of medical journals and discoveries made by health professionals. Ultimately, doctors we spoke to say the most important lesson may have little to do with medicine. Newsy's Lindsay Thies has more.
As of this morning, March 13th, CDC is reporting more than 1,500 cases of COVID-19.
If we only knew then what we know now, back those nearly 500 days ago when coronavirus was declared a national emergency in the U.S. Reflecting on this pandemic years from now, doctors think we'll be impressed by the speed of science, but depressed by society's response.
The most important, I think, is that thwarting a virus in a pandemic is a combination of a medical and scientific endeavor and a socio-political endeavor.
Early on, sequencing the COVID-19 virus helped scientists develop tests, vaccines, treatments, and even track the virus variants today. One hindsight lesson, getting tests to people quickly. The FDA didn't greenlight rapid or saliva tests until late spring, summer 2020.
Spring of 2020, really no one could get tested. It was almost impossible to get testing. Now you can go to your local drugstore and get a home test kit to really help us understand and control this.
And of course, there's vaccines. mRNA research helped jumpstart Moderna and Pfizer's vaccines, now in the arms of more than 163 million Americans.
The vaccine has been very, very effective, and we're seeing it to be very effective and very safe in a lot of people, hundreds of millions of people who have received this vaccine.
But of course, there's the behavior part. Both vaccines and masking have been slowed by hesitation and politicization. The latest Kaiser Family Foundation data show more people in Republican-leaning and rural areas say they would definitely not get a COVID vaccine.
I haven't gotten it. Probably won't get it.
It's a new vaccine, so I'd rather wait to see what happens in the future with that.
I'm personally done with the masks for my child. In my opinion, it's a choice we've made for our child, and he is immunocompromised.
It's going to lead to, has already led to hundreds of thousands of deaths more than we needed, and I think we're unfortunately staring down at another few 100,000 deaths that did not need to happen.
So, have we learned? We have more tools to be sure, and the data to back it up. But currently, unvaxxed and unmasked situations mixed with the highly contagious Delta variant, now making up about 80% of sequenced COVID cases, it's a perfect storm, leaving hospitals and those working in them feeling deja vu.
It just seems like we're just fighting a losing battle here.
We have the capacity now to really shape how we can behave, but it will require some behavioral modification for us to have that normalcy. It comes at a cost. It comes at wearing masks. It comes at vaccination. It comes at washing our hands as much as we can, and potentially testing and screening. Again, they're not asking the world. We're asking very small things, but we have to do something.
For Newsy, I'm Lindsay Thies.
We're not out of the woods yet, but you can't help but to feel like we're closer to the end of this thing than we are to the beginning of it, if you know what I mean. So we asked some of you to reflect a bit and tell us the biggest lessons you learned from the pandemic. We'll let Newsy's Stephanie Sandoval take it away.
For many of us, pandemic life meant staying away from people we love and our favorite restaurants, and working from home. Nearly a year and a half later, the pandemic continues, but there have been many takeaways, and we decided it was time to reflect. Newsy put out a call out on Facebook and Instagram asking, "What's the biggest lesson you've learned from the pandemic?" We got dozens of responses, so I decided to reach out to a few of them.
Hello. Yours was one of the more positive comments. You wrote to enjoy life and not take the people you love for granted. They may not be here for long. Why did you decide to post that?
During the pandemic, we were all isolated, and we didn't get to go see our older relatives or even any relatives.
Like a lot of us, Kimberly Benjamin stayed home for most of the pandemic and really only left to go to the grocery store.
So while we were in the pandemic, I realized, the most important thing in life is the people around you, your family and your friends.
Hello. Hi, Ashley. This is Steph. For your comment, you wrote flexibility. Can you kind of explain why you posted that?
The COVID restrictions opened up when I was out of the country. I'm from the U.S. and I got stuck in a different country for about 2 months. And I just remember saying, I just have to be flexible. I'm just going to roll with it.
Ashley White also owns several small businesses, including one that relies on community events.
As you know, lots of events, including big events, were canceled. So that took a huge impact on my business. So that's really what the pandemic taught me, is just to be flexible, because there's a lot of things that are just not in our control.
Hi, how are you?
I am well, how are you?
What's the biggest thing that you've learned during the pandemic?
The biggest thing that I learned were a few things, kind of like wrapped up into one, really about slowing down and appreciating and valuing the time that you have with people.
How are you staying positive during all of this?
We have choices. I always tell people, you have choices. You can choose to be happy or you can choose to be upset and mad. So every day before I go to bed or before I finish doing whatever I'm doing, I'm going to pull out that positive, because that's what we have.
The pandemic isn't over yet, but the lessons learned will stick forever. Stephanie Sandoval, Newsy.
When you're back, we'll tell you how some people affected by COVID are appealing to lawmakers for help.
Many people have talked about autonomous weapons as the third revolution in warfare. The entire military capability of the major nations is going to be replaced with largely autonomous weapons.
It's time to launch negotiations to ban killer robots.